Hi everyone, this video is about functional tremors. So a tremor is something where a limb of your body will shake and you can't really control it. I'd say a seizure might be the whole body and a tremor will be like a, a vibration type movement of one part of your body. So I've had tremors mostly in my legs, and it's another one of those things you think, what are my triggers? What sets this symptom off? And that takes a bit of work to try to find out what that is. In my case, I had a physiotherapy exercise, balancing on one leg, and I had squatting. And then doing that movement, for some reason, flipped a switch in my brain, and then I would have tremors in my legs. Other times I had tremors, I'm not sure if it was an anxiety or stress response, but it was often connected with other symptoms as well, so like dystonia or stuttering. So how do we deal with tremors? I don't think there's one kind of instant cure that works for everybody. And again, check out neurosymptoms.org. Some of the tips I'm going to mention are directly from the Neurosymptoms website. So, different things that you can do in the moment if you're having a tremor. Looking in a mirror and getting your brain to recognize what's going on and that it doesn't need to do that. You can do... say if one limb, one arm or leg is having a tremor, try and mimic with the other limb. So it's trying to get your brain to wake up from what's happening. It's sending some incorrect signal there, and if you can kind of trick the brain into realizing what's going on, and then it doesn't need to do that, that kind of rhythm can stop the tremor. There's a progressive muscular relaxation technique, and I would suggest practicing mindfulness is a good habit for our general mental health and for dealing with functional symptoms. And there's one mindfulness exercise you can do, which is focusing on different parts of your body and breathing through different parts of the body and tensing the muscle and then relaxing it and breathing through that. And so working through your body and tensing different muscles and then relaxing them, and that could be a way to deal with a tremor. Just one note about tremors, that you can think about whether for you it's triggered by anxiety or a stress response. And Dr. Stone says that not all functional symptoms are linked to any mental health condition. So you need to just think about for yourself, has this symptom come on? Am I really stressed about something? Am I anxious about something? And is that what's brought on this particular symptom? And it may not be, but it's just a question to think about. And if so, then it can be worth exploring with a psychologist or a psychiatrist, some management techniques, some strategies for dealing with anxiety, and then that may reduce your functional symptoms. Okay, I hope that this video has been helpful. For me personally, I found that tremors would just last a short time and then they would go away on their own. And so I didn't really think about what techniques to use to stop them in the moment. For me, they just lasted a few minutes and then they went away. And my main way to deal with it was to practice techniques for dealing with anxiety and stress that were just better for my health overall, and that reduced the frequency of those symptoms like tremors. So sometimes dealing with FND, it's not so much attacking the symptom as it is managing the rest of life and reducing stress and reducing anxiety as a way to improve your quality of life, and that'll actually reduce the symptoms. If you have any tips for dealing with tremors, please leave a comment below.